Erectile dysfunction. Two little words that many men hesitate to say. But that has an impact on the health of numerous men, and may even be affecting. I am Dr. Tiago, and I am a urologist. And today we'll discuss a very effective solution for this frustrating problem that is related to Tadalafil medication. We'll discuss the mechanism of action, if there is any problem or difficulty with taking this medication, long term, what is the effectiveness of this med? What are the primary adverse effects? And in the event that there is any more efficient and superior way to acquire it that has a more favorable effect in the treatment of the dysfunction, erectile. And in the end, I will also comment that Tadalafil, it is utilized for a treatment that is commonly performed on a regular basis in men between the ages of 40 and 50 years old, besides impotence. Therefore, stay with me till end. BC, this video is going to be extremely important and extremely relevant for your health. To initiate a discussion about Tadalafil medication, crucial that you first understand the mechanism of action of this med within you. Tadalafil inhibits an enzyme called phosphodiesterase. It's a difficult technical name that you don't need to know, and what matters is the action of this enzyme in our body. She has the ability to control the blood flow to our male reproductive organ, specifically the penis. It's as if she were the blood faucet connected to the man's penis for medical purposes. When a man is stimulated, whether due to visual or tactile issues, when he feels like being in a romantic relationship, the brain sends commands to the penis that will enhance the flow of blood to the specific region. What will be the factor that causes this man to experience an erection? The problem is, if we did not possess control mechanisms, this erection would be extended and enduring indefinitely, and this could potentially cause problems, as ischemia in the cavernous bodies, and can result in serious problems. Erection? Thus, there is the phosphodiesterase, that enzyme that turns off that tap completely, and causes the man lose the erection when he is no longer required to perform his duties. Tadalafil, she is going to act on that faucet, preventing it from closing. That's why she's going to make it easier. The mechanism of erection in these men. Thus, Tadalafil will help the erection to be maintained. This is vital for you to comprehend. First point, and the first cue many patients have regarding Tadalafil. If you take it in a purely unadulterated fashion or form, simply without stimulus, you will not have an erection. Tadalafil does not cause a person to have an erection. It does not make the person feel like having a relationship. What will cause her to have an erection is the stimulation. It's the will. Sexual desire. Tadalafil will solely enhance the effectiveness of the medication, via which blood enters the penis. It will keep the blood there, facilitating the process of achieving erection. What is the effectiveness and efficiency of Tadalafil? What's the percent of assistance? How is this done in a good manner? Searching for medical lit data, we see that after 12, duration of Tadalafil usage in weeks, these studies utilized various dosages, briefly, 10 milligrams and 20 milligrams, and then these men answered questionnaires. This indicated that the Tadalafil dosage was 10 milligrams, improved by 67%. It is the erection of these men. When the dosage amount was 20 milligrams, the enhancement observed was a significant 81% increase in erections. So, we see that in the long term it is indeed a remedy, extremely efficient, achieving the prescribed 20 million dosage level as intended. Efficacy above 80% is observed in the study in enhancing erectile function, but like any TX, there are adverse side effects that are highly significant and need to be talked about. I will comment here with you the most common to appear, but not only ones. Combined, the main side effects of Tadalafil. Men report the initial one is giving me a headache. How it helps the process? It causes a certain vasodilation. Some men refer headache experienced when using Tadalafil. And the second one is facial flushing. In short, this vasodilation ultimately results in the man's face becoming even redder than before. What we refer to as facial flushing. A few men continue to complain of stomach pain, discomfort experienced in the intestines and pains felt in the muscles. It is also a side effect that is relatively small in nature. frequent usage of Tadalafil there, this pain typically tends to manifest in both the back area, as is commonly seen in the lower extremities. Briefly, in legs, having a headache, facial flushing, muscular discomfort, along with congestion and pain in the nasal area are being experienced. Stomach, those are the primary side effects commonly reported by most individuals for those who use Tadalafil. But what about the risks related to heart health? Many patients have this fear of what this particular medication has the potential to cause heart-related complications. Here I need you to understand something that's crucial, so kindly pay attention here, please. For those who already have a heart problem, it is one thing. People without heart issues have contrasting attributes. For those who already have a heart problem, has already had a heart attack and takes a medication called isosorbide. What is the trade name for esordiol or monocordial medication in the market? Incapable of taking Tadalafil. It is the main against indication for the use of this substance is patients who've had heart attack use esordiol and monoc. They cannot take this substance. Cannot take Tadalafil. Doc, I've had a heart attack. Yet no, I can take. In such cases, I suggest that you initially consult with your cardiologist. What for? He conducts an analysis if you are not having any problems. Cardiological condition that may be aggravated by Tadalafil. Combined, for patients who do not have any heart problems, Tadalafil does not give rise to or contribute to the occurrence of the heart problem. Combined, Tadalafil is a safe medication for patients who no heart issues detected. Occasional cases, only hypertension or only diabetes, hasn't had a heart attack, haven't had any heart problems, have had no heart problems. They can utilize Tadalafil with a sense of tranquility because the medication, even in the long term, even when using constantly, it will not cause any problems in the heart. Combined. And any side effects when using Tadalafil medication? Write below in comments. As it's crucial for us, please share this important information. And with regards to how to take Tadalafil, is there a more optimal way? Basically, there are two methods to take Tadalafil. First one, most common, 20 milligrams of Tadalafil are used, which we call on demand. Briefly, when the man is going to have intercourse, often it is taken 30 minutes to 1 hour prior to sexual intercourse, and the impact it has when taken in 20 milligrams. It can endure up to a maximum of 36 hours. This is very interesting. Is one of the great benefits of Tadalafil when we compare it with the other ones. It's with other meds used for treatment of erectile dysfunction, like sildenafil. Viagra is the effect of Tadalafil on the body, lasts for a much longer duration than the other medications for erectile dysfunction. Because of that, there is an alternative approach to ingest Tadalafil medication. What is the frequency of daily usage for the medication at a lower dosage? At a dose of 5 milligrams, at this dose, Tadalafil was developed to be taken daily, even if the man is not going to engage in sexual intercourse. If I take med, will I have erection? I've clarified that at the video's beginning. Medication itself doesn't cause erection. It facilitates, therefore, this dose of 5 milligrams daily. It appears that in the long term, the data is still somewhat contentious and there is a scarcity of it. However, it appears that way. There is a slightly more favorable outcome when compared to the expected, when taken upon specific request or on demand, combined. My suggestion for you would be to consider, well, here I'll say what I tell my patients. In office, this is variable. People exist. They don't like taking medicine every day. So typically for him, recommended for on-demand use. Now there is that other person who doesn't like to have the link. Taking medication to have relationship. Many times he is not prepared. Frequently he does not want to be carrying the medication. And then for this particular patient, the best way will be to use Tadalafil, 5 milligrams daily. It's a very individual matter, and that there is no better or worse way, varies from each. It is a matter that depends on the preference of each patient. Why? The important thing is to evaluate which of these ways to take, on demand or on a daily basis, will fit better in your requirements and in the manner in which you live your life. To conclude, I want to discuss Another application of Tadalafil, which is also of great importance, which is a very common disease from the age of 50 years old, which is benign prostatic hyperplasia, enlargement of the prostate, Tadalafil. It can be employed for the management and treatment of these patients. The Tadalafilit. It will cause a relaxation of the muscles from the prostate area and will cause these men to improve the flow. Urinary. So, besides, these men to have improved sexual performance, improvement in erectile performance, these men will also optimize and enhance urinary flow for improvement. Also treating benign prostatic hyperplasia. Thus, Tadalafil used daily at 5 milligrams. It is a possible choice for therapy, very interesting, for men with both problems. Sexual dysfunction problem, connected to benign prostatic hyperplasia, because by using only one medication, I am able to treat both conditions. Problems combined. I hope this video has been helpful for you. Don't forget to like the video, sub to canal, share this video with those you believe will derive advantage from this information. Also, if you have any questions, please put in the comments down below. I am Dr. Tiago, and until the next video,